Welcome to Season 5 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Joshua Sharfstein, Vice Dean for Public Health Practice and Community Engagement and a former health commissioner here in Baltimore, Maryland. Our goal with this podcast is to bring scientific evidence and experience to shed light on critical health issues. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Today, Stephanie Desmond talks to Dr. Paul Spiegel, who heads the Johns Hopkins Center for Humanitarian Health, about the millions of Ukrainian refugees whose lives have been completely upended by war. Dr. Spiegel is just back from a stint working for the World Health Organization as an emergency coordinator, and they discuss what he has seen. Let's listen.
Paul Spiegel, thanks so much for joining me.
It's a pleasure, Stephanie.
So you have just returned from Eastern Europe, where you were working with refugees from the war in Ukraine. And I'm wondering if you could first remind our listeners the work you were doing.
Certainly. So I was the emergency coordinator for WHO, the World Health Organization, for the last 6.5 weeks for the refugee response. So I was helping WHO coordinate their response in the refugee hosting countries. There are 5 that are contiguous, as well as the Czech Republic, which has been receiving a tremendous amount of these refugees.
So you have been to a lot of humanitarian crises in your career. Talk to me about how this one looked compared to others.
Yeah. Well, I've been doing this, sadly, I looked and it's been 30 years now, been doing this sort of work. And this is one of the most different and interesting responses that I've seen. And it's primarily because, except for Moldova, all of the other surrounding countries are part of the European Union. And they are both highly regulated because they're part of the EU, but they also have extremely strong and competent governments and ministries of health and health systems. And so the way we responded and need to respond to this situation is very different than in other low and middle income countries where more support is often needed.
What did they need?
They, interestingly, they didn't need in terms of materials very much thus far. It's primarily been women and children, relatively healthy women and children coming across the borders. And yes, there are needs for continuity of care. We have to make sure there's sufficient child and maternal care, but there is in these countries at this point. And there has not been a run on the hospitals. Their bed capacity is fine. When we talk about do they need vaccines, do they need medications at this point, they said they did not. That may change in the future. I think what they needed and what we tried to do was provide some sort of technical advice, particularly because we, the UN and the international NGOs, have had a lot of experience of hundreds of thousands, if not millions of people crossing borders in a short period of time. And so there are a lot of protocols, standard operating procedures that need to change because of the amount of people coming over.
So the quantity is larger than you've really seen before.
In such a short period of time, there's now the UNHCR numbers show approximately 5.5 million people have crossed the border since February 24th. So that's an incredible amount of people in a short period of time. But they aren't just staying, we had to look at, and the operation had to really be divided at least into 2 aspects, if not more. One is making sure that the refugees, when they're crossing over, transiting, that they have, and the governments are primarily doing this, that they have sufficient care, first aid, psychological first aid, referral if there's an emergency. But the goal is to help them to get to where they want to go to temporarily reside. And then the second component is working and to know where they are residing and then what support they need. But I think it's really important to say that the governments here, unlike in the migration crisis in the 2015, the governments here have opened up everything to the Ukrainian refugees, meaning they're allowed to work. They have the same level of access and healthcare as a national, and they have the same access to education as a national, which is wonderful. And I wish that all migrants and refugees would be able to have this in Europe and elsewhere.
It's got to be heart-wrenching to see some of these folks. What did you hear from them when you spoke to them?
Especially at the borders, I visited many of the countries and the borders of Poland and Ukraine, and then Slovakia and Ukraine. Before you even speak to them, you just look at their faces and you see sort of a dazed, almost disbelief of what is happening, because it still is hard to believe that this is happening in Europe at this time, and given what happened in World War II. So, and then the Balkan and the Balkan Wars. So, I think there's disbelief. There is a feeling of, and everyone said this, that they will go back as soon as they can. Many have, besides their attachment to Ukraine itself, many have left their partners, their husbands who are fighting. And one of the areas that I think will be as important, or if not more important, will be the provision of mental health and psychosocial services to these people, because that is much more difficult to provide than some of the basic primary health care and hospital care, for a variety of reasons that we could discuss.
Mm-hmm. So I wanted to hear more about the mental health crisis is probably looming in these countries.
Yeah. One of the biggest problems is that in many countries, including ours in the United States, there isn't sufficient capacity overall to deal with all levels of mental health, psychologists, psychiatrists, and it's both in terms of personnel, but it's also in terms of payment, right, for this sort of services that is not often covered. Each country will have a certain amount of mental health services available to their populations, and they will equally be available to the Ukrainians. But furthermore, you have differences in culture and differences in language, and language is hugely important. And then we can look at what types of services should be available according to where they are on, let's call it, the refugee journey. At the beginning, and this is what we saw firsthand, is people are in shock. So you want to give what's called basic psychological first aid, but you don't want to delve into their situation at this point. It could even be harmful. Then the other component is, and we saw the many local NGOs doing this very, very well, is making sure that children have the ability to play. So to have child-friendly spaces, to be able to have someone that they could talk to and draw pictures. That's hugely important. And that was being done pretty well at the reception centers. People don't stay at the border. They move quickly to the reception centers. That's been done and very well. But there will also be a need, and is a need already, for people to talk about what's happened and get some sort of professional support. And that's going to be difficult. It's EU's a regulated country. And so even though they're trying to expedite the process, Ukrainian healthcare workers, for the most part, are not able to work autonomously at this point. Ukraine's not an EU country. They haven't been certified, etc.
So you talked about psychological first aid. What does that phrase mean?
Psychological first aid is supporting, it's almost as it sounds, you want to be able to support the person, for him or her, in this case it's mostly it's mostly women and then the children, to be able to make sure that they're able to express themselves and to provide almost a psychological band-aid, so that they understand that they are safe, that they understand that what their options are in terms of housing, but not go into something much more, at this point, much more serious, because when you start delving into their actual experiences and leaving their husband behind, or partner, sexual violence, that needs to be done in a more stable and also a consistent environment where they may be able to save someone. So It's that early phase to ensure that they feel safe and that they're able to speak when they need to speak or wish to speak.
I'm curious what surprised you about what you saw?
Lots of different things, I would say. Firstly, as I said, I've been doing this all over the world, and this becomes, let's say, more personal than professional. But to see, for example, people that are so similar to us, and when they come over with their dogs and they're dressed in the same way, listening to the same music, that's different from what I'm used to, because I've often worked in Africa and the Middle East and Asia. So from a personal point of view, it's been interesting to try to deal with that. I don't believe, and I hope it has had no effect in terms of how I respond from a systems point of view. But I've seen this consistently, both how one can relate to people that are affected, and then I've also seen it amongst the volunteers. So you have volunteers all over Europe now supporting these people, and when we would meet with the volunteers, it was clear that they needed probably more support than psychological first aid. They needed someone to be able to speak to, because this trauma that they're seeing for the first time amongst these people can be overwhelming. The other area maybe I could just mention is that this, as I started at the beginning, is that it was an odd feeling to as a humanitarian, you want to act, you want to immediately do something for these people. And what was interesting, but also really important, is that the governments are doing, and the local volunteers and the local NGOs and community-based organizations are actually doing the doing, and they're doing it well, which is wonderful, because that's ultimately what we want. We want the international community to support what governments, volunteers, and national organizations either need support on or are not able to do. This has been wonderful, but it also made us all think about, well, what will be, and how can we as the international community support governments as they move forward. And it means that we have to change our playbook as well.
Mm-hmm. This is not going to be a quick end. There's not going to be a quick end to this, I don't imagine. And I'm wondering sort of what you see this evolving to in the longer term.
Yeah. This is one of the big concerns that I think many of us have, and it relates to the current situation. There aren't refugee camps, thank goodness, as in some other countries. Most of these people are either housed by people throughout Europe, people that they don't know. Some know, but many do not know. They're in hotels, they're in dormitories. And the worry, I think, is that people did this spontaneously, very generously, but perhaps they didn't think that this may go on for months or even years. And so one of the concerns will be, as the months go by, and as we've seen in other countries, the welcoming may change. Governments are doing their best to make sure that refugees are getting some funding and or have services, and also those that are hosting. But that may change over time, and you may not want families in your house for 6 months to a year. What will be the response when that happens? Will resentment grow? And then where will these people go? And what will be the longer term effects in these hosting countries are things that we really need to think about now.
And then I guess my last question is, you mentioned to me that this really hit you emotionally. And I'm wondering if you could tell us a little bit about that.
Yeah, it's something that I'm not used to and don't often love to discuss, but I liken it a bit to, as a physician, or I guess a nurse or whomever, a healthcare worker, you try to be dispassionate and do the best you can always. But I remember as a physician, there were some patients that somehow, let's say, got through this wall to a degree. And it's the same in humanitarian emergencies. So it's happened in many other places. Certainly when I was in the Greek islands and the Syrians were coming over in the boats and in their faces, it was emotionally disturbing. This time, I think it became a bit personal. My grandparents came from Poland. So there's, and this is happening in Europe. And so the cultures are so similar that it makes it a bit difficult. I think it was not as difficult when I was there, but after now coming back after 6.5 weeks, thinking it through, and the effects have been and I think I need some psychological first aid. But it's been challenging to work out some of the feelings that occur, and I assume that's the case for on the television. One of the things that I'd like to emphasize is the frustration amongst many of us. Just before I responded here, I was in Afghanistan with WHO for 6 weeks, and the needs there are extraordinary. And it's unfair in many ways that so much attention goes to Ukraine. It's not that I want to diminish attention to Ukraine, not at all. I want that same amount. The same amount of access that we have to work, to same thing that's happening with refugees throughout the world. But I think that's more of a dream than a reality, sadly.
Paul Spiegel, thanks so much for joining me.
Thank you very much, Stephanie. As always, it's a pleasure.
Public Health On Call is produced by Joshua Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by Niall Owen McCusker, Matthew Martin, Spencer Greer, and Holly Cardinal, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media support from Grace Holz Fernandez. Thank you for listening.